y'all, it's been a minute since I've had a sit down with you guys. I wanted to do a video, just kind of like giving y'all like a little updated hygiene video. Like I said, it has been a while, so let's hop to it. So today is definitely about, as you can see in the title, it's about just tips on what I say to patients, how I communicate with my patients so I can be an effective practitioner, clinician, what have you. Just small little things that kind of make sure that your patients know you know what you're talking about. You feel me? Okay, so let's get started. I don't know how many tips I have. We're just gonna title how many tips I have at the end, and we're gonna be done. So I love like when a patient sits down and tells me, oh, I hate the dentist. And I say, well, thank God I'm not a dentist. You feel me? And they laugh and like have a little chuckle. That kind of like eases their mind, so they're not feeling like, they're gonna be getting drilled and all of like, all of the bad negative things that comes with being a dentist. A lot of times people will say, oh, and forewarning, I am coming off of a cold, so my voice is a little different, a little deeper, you feel me? But anywho, I get a lot of patients that tend to say, I'm a baby, I'm scared, and I'm like, we take care of babies. I promise you we do. We take care of babies. So stuff like that gets them kind of like looser. They don't feel as tense, when you're talking to them, having conversations. So stuff like that does have an effect on patients, whether you realize it or not. A laugh does ease the mind quite a bit. So when it comes to clinically speaking, usually when I probe them, or even before I probe and I kind of get like a synopsis of like how their oral health is at home, I ask them what do they typically use. So I ask them, what do they typically use? Do you use regular string? Do you use a manual toothbrush? Do you use regular string floss? And then they kind of tell me, well, I'm not that consistent. I typically use those, those little placard things. And automatically that tells me, bingo. So I know what to use, what to say, leading on as far as the treatment is concerned. So automatically off the rip, 9 times out of 10, those patients are not doing what they need to with those floss fix. I typically break it down for them to visually understand what I mean by floss sticks not being the best mechanism as far as removing plaque from the teeth. So normally I say, this is your tooth, it's round. This is the floss stick, it's straight. If you can't contour around the body of the tooth, you're going to be missing a lot of your surface area. You need the regular string floss to contour around the teeth, so you're not pushing plaque to the side, you're actually pulling it off the tooth. And that kind of lets them understand when I say try not to use floss sticks unless you're using, floss stick to remove food from your mouth, from between your teeth. Otherwise, don't use floss sticks on the regular schmegular, please. And so that also lets them know, okay, I might not be in so well, and then that's when I lead up with, well, let's add irrigation to your treatment today, because you have that bacteria in your mouth. That will be a reason as to why we want to irrigate, to flush out the bacteria and the microbes, the P. gingivalis, stuff like that. So that way you're not at risk for having gingivitis, or not at risk for continuing on with periodontal disease. So that will help, incline the patient. Oh, I already admitted I'm using the wrong thing. I understand now why I need to use the right thing. And okay, so now the clinician wants to help me by using a rinse that's going to help get rid of the bacteria that I left behind. It's a win-win. So this is one of the tips that I would say, use what they tell you. If they admit they're using a manual toothbrush, they probably have recession. They probably need some Sensodyne or some Clinipro. They definitely need fluoride and have sensitivity. You try to explain to them. When a patient also explains, when I do use a manual toothbrush, I tend to brush hard. Well, I also tell them use your less dominant hand. I'm a very observant person. Like usually if I see them, I take their blood pressure. Oh, I see your watch is on your right hand. You're a lefty. I see that you have a lot more, recession on your left side than your right side, because we tend to brush harder closer to the area where we are more dominant. And so I tell them use your less dominant hand, and they're like, oh, how did you know that? Like, I'm just good like that, you feel me? But yeah, you have to be observant. You have to use what you are seeing and what they're telling you to tell a story. You can off rip tell so many things by what a person is doing, what they're not doing. Like I said, the floss picks, you can say, oh, I know if you see plaque on the incisal edges, or not the incisal edges, the interproximal edges of the teeth, you automatically know they're either not flossing, they're not using the right type of floss, or they're not flossing the right way. You can automatically tell off the rip. And I say that too. I say, you're either not flossing, you're using the wrong type of floss, or you're not flossing the right way. I'm like, oh my God, how did you know? I can tell when your plaque is sitting on your teeth a certain way, what you're doing. When the plaque is sitting on the marginal surfaces where your gums meet your teeth, I can tell that you're not flossing, you're not brushing at a 45-degree angle. I can tell that you're brushing in circles. Off the rip, go ahead and tell them what you're seeing. You can even give them a mirror, because that way they'll know they're seeing stuff with you. The rolled gums, your gums should be knife-like. If your gums are rolled, that means you're infected. It's like a bug bite. We want to get that bug bite down before it gets super infected and it causes some other issues like bone loss. Stuff like that really does help. Using visual cues, x-rays, you walk through the x-rays with them. Tell them what you're seeing, because they're not going to know what you're looking at unless you tell them. Tell them where the bone should be. It should be by this radiopaque area. The enamel, if it is starting to go down away from the enamel, that's telling me under your gums is some infection that's causing that bone to go away from that infected site. What we want to do is do a deep cleaning, similar how I was probing you. I'll go below the gum line ever so gently but efficiently, and I remove those microbes. That way your teeth don't get worse. So visualizing, already walking through, explaining to patients with them what you're seeing, what they're seeing, helps them understand, okay, I'm not crazy, or okay, they're not trying to just, tell me what I need a deep cleaning. I see for myself why I need a deep cleaning, because they understood, because I now understand I have an infection, I'm using the wrong type of mechanisms, things like that. I also like to explain to patients when they're using a manual toothbrush, that obviously that causes the bone loss, it can cause recession, that you need to be gentle, because your gums don't come back like that. They don't, and unless you want surgery, you're not going to be getting your gums back. So let's be gentle. Use a mechanical, use an electric toothbrush. I'm very, very biased. I love Oral-B. That is my favorite type of toothbrush brand. They have pressure indicators in there, so that way it will literally snitch on you to tell you that you are using too much pressure on your teeth. Don't do it, okay? For a lot of my periodontal patients, I like to tell them to use a zero alcohol mouthwash. Reason being, obviously, once you're done with your deep cleaning, your gums are going to be a little bit more sensitive. Using that alcohol can make you sensitive, can have like a burning sensation. And for those who don't know, periodontal disease is an injury in the mouth. You're bleeding, you're infected. So same thing when you have a scab and cut on your arm, you don't want to pour alcohol on it. Of course, it does good by killing some bacteria, but not all bacteria. And that can also lead to other issues. So what I like to say, suggest that they use a zero alcohol mouthwash for now. Help raise the pH balance in their mouth, because periodontal disease does cause acidity because of the bacteria. The bacteria secretes acid on the teeth, and therefore your pH level is lower in the mouth, the periodontium. Therefore, I recommend you use a zero alcohol mouthwash to help facilitate in your pH balance rising back up. I also like to throw in using an alkaline mouth rinse, an alkaline water, smart water essential. Anything with a high pH, anything that is above a 7 is a basic it's a basic pH level. That means that it's going to help balance out the acidity in the mouth, in the periodontium, so that the bacteria that is in there does not wreak havoc on your enamel and on the rest of your tissues. So I definitely recommend anyone who has periodontal disease, anyone who has GERD or any type of gastrointestinal issues, that they use an alkaline water. You don't have to use it all the time, but this does help. This also helps with people that are suffering from diabetes. Diabetes can also be affected with your pH balance in the mouth. So drinking water that helps with the pH does affect the rest of the body, mind-body connection. So I do recommend high alkaline water for patients, pretty much anybody, honestly. Healthy patients that don't have periodontal disease, we all have that acid in our mouth from just, underneath our tongues, our saliva glands, they secrete acid, saliva. So I do recommend at least every once in a while drinking water, so that way acidity does not erode chemically your enamel. I love telling patients that have cavities, especially once we went over the x-rays with them, with the doctor, and have been treatment planned, or have already been an established patient and comes back and they haven't quite reached their full treatment plan, they haven't finished it out. I like to encourage them to, of course, one, go ahead and get these fillings done, because teeth next to each other and just in general, bacteria can travel throughout the mouth. It doesn't just stay in one area. That bacteria that causes the cavities can also move out throughout the rest of the mouth, and that can also cause more cavities. So let's go ahead and get these cavities filled, taken care of. That way we're not at risk for having more cavities. However, during that time when they are at home, taking care of their mouth, brushing their teeth, flossing, I like to encourage patients to floss before they brush. One reason is because once you brush, of course, you're brushing all of like the facial, lingual sides of your teeth, right? However, when you're flossing, you're still pulling out bacteria, you're still pulling out food, plaque that can get on the rest of the surface of your teeth. So why not go ahead and pull it out first, get that clean, and then brush the rest? That way, everything is clean. You're not pulling out more dirt. It's like, let's just go ahead and get that out the way. You feel me? So it's just like you're not cleaning everything. You're still having stuff that's dirty on top of you. So that's just kind of like a visual, but it is a way. But it is a way I like to communicate with patients that can kind of, put on layman's terms for them. However, along with that flossing, I like to encourage patients to use Sensodyne, and not only put Sensodyne on your toothbrush, but put Sensodyne on your floss. So I tell them, put a little bit on there, floss it between your teeth, spit and leave it on your teeth. This is going to help occlude or close up the microscopic holes that we cannot see on our teeth. That way those areas can be closed up and you're not so sensitive. So I like to break that sensitivity down for them. When they have recession, even just in general, I like to use my hand and my wrist as a visualization, especially when I have my PPE on, my lab coat. I say this area is the tooth, and this area here is a normal tooth. And so when you brush hard, you're brushing, you're pulling everything down, and that exposes the rest of the teeth, the darker part of the tooth that people want to whiten and stuff like that. And so this is the darker part of the tooth, known as dentin. Dentin is very spongy, it's very porous, and it has holes that allow hot and cold water, things to get rushed in there. When you feel that rush of cold, rush of hot, that makes you sensitive. So what the Sensodyne will do, it occludes, it kind of like a paste that occludes, temporarily speaking, those holes in the teeth. So that way it's blocking that hot and cold water from coming into your teeth. That way it's not sensitive. I also like to put it a tree without bark. A tree is more prone to infection and sensitivity and cavities because of it not being protected by your gums. So that sensitivity will help. That sensitivity can go away if done properly. Make sure that the patient understands that when you apply that Sensodyne, you just want to spit. You don't want to rinse, because rinsing takes away the effects of the properties. Rinsing is like putting lotion on your arm and washing it off. That's essentially what you're doing. You're not getting the full value of that product because you're rinsing it away. You're diluting it, so it can't work as well, obviously. And so when I tell them that, they're like, "What? Oh my God, I can't believe this. No one's ever told me that." Well, that's why I'm here. Okay. I do want them to understand that it's very important. Of course, read your instructions. Not all products are meant to stay on your teeth, like whitening products. Please read your instructions carefully. Speaking of whitening products, so a lot of patients love their whitening. They love, make sure their teeth are white. A lot of patients drink their coffee, tea, what have you. And it's important they also understand whitening can also damage your teeth, especially when you do it for a long period of time, especially in one setting. It's important to note that whitening can be very detrimental if you're doing it the wrong way. So what I also like to suggest, and kind of like a practical understanding, is this: that whitening is like shampoo and Sensodyne is like conditioner. Once you say that, they understand. Obviously, we don't want shampoo on our hair for that long. It strips the hair of nutrients and moisture. So you want to double back by using a conditioner, i.e. Sensodyne. The Sensodyne is supposed to be on your hair for longer. It's supposed to be on there. Even if you leave a little bit on, it kind of still works really well because you're leaving that moisture on there. And that's what, helps protect the teeth and locks in moisture and locks in that safety, so your hair isn't prone to breaking. Your teeth aren't prone to breaking and aren't prone to acidity. So stuff like that, breaking it down to literally a visual, or just breaking it down to a simple understanding where your day-to-day person will understand, helps a lot. And they're like, oh, they think of you as a genius, which you are. but they think of you as like, oh my God, my other hygienist never told me that. And stuff like that really does help, build that bond and that trust factor with your patients, so they're more than willing to come back and actually use those techniques to apply to their day-to-day oral hygiene health. So another thing I like to say, I personally still have all 32 teeth. They weren't gonna get my teeth. My teeth grew in perfectly fine. I have no operculum, which is the tissue that could cover a tooth. I have no operculum covering my teeth. I have no cavities. I can reach everything, but I can reach them because I tell my patients, and I learned throughout trial and error, that the best way to clean the teeth is to not open super wide. I know we think that we need to open wide, but actually the opposite. We need to close. So think about it like this. I like to do this to my patients so they can see and understand what I mean. So this is our mouth. When we open, it's like a small little area. We don't have that much room. But when we close, this is what our teeth are doing. This is what our mouth is doing, and it opens. So when we open, our masseter muscle right here is active. So it's really, really hard. It's not able to, move too much because it's a muscle. It's going to be tight. It's going to be tense. And it's not going to have a lot of give. Versus when we're relaxed, from this to this, it's movable. It's palpable. I can move it around, kind of squeeze and push. The same way when you're brushing, you can open and close. If you close, you can reach the back of your last tooth with ease. I promise you. Try it out. It's going to be weird at first, and I always tell patients, it's going to be weird. It's going to feel like odd because you're not used to it. You're not used to closing your mouth on your toothbrush. You used to open as wide as you can, reaching back there and just giving up because you can't reach the back, and then you have a cavity. You feel me? So let's work on communicating to our patients the effectiveness of closing, because it does give you more room. I promise you it does. Even when you're a clinician and you're actually trying to reach the back of those teeth, those wisdom teeth, 1, 16, 32, you're trying to get all the way back there in the back, and you can't ask them to close a little bit. Even halfway, it gives you way more room than when they're open all the way. So try that technique out. It does work wonders. And then they'll understand while you're cleaning them, and you're on the distal of that last tooth, and you say, see what I mean by closing? And they're like, oh my God, I never knew. And you pull out that calculus and that plaque and you show them. That's the same thing they'll be doing. They'll be pulling out that bacteria when they're brushing. And I always like to say, act as if you're about to close and chew on your toothbrush. And then once you have room, open up a little bit. And if you feel like you can reach still by opening a little bit, then you can still maneuver well and get all the bacteria off. But closing and then opening is gonna work wonders. You'll have to forgive me. This cold is like beating me right now. Me. Let me stop. Okay, I have my notes right here because sometimes I can forget what I want to say. So I just try to write everything down. Okay, of course, we always, and I'm all over the place, y'all. Y'all should know me by now. My notes are never concise. They're all over the place. Back to flossing, back to brushing. Of course, we want our patients to use soft bristle toothbrush. But even if they don't, technique, honestly, is the most important thing when it comes to brushing. It's mechanical, right? So if we're not touching those areas, then what's the purpose? I don't care if you have a soft, medium, or hard toothbrush. If you're not brushing the right area, it doesn't matter what you have, you're still gonna be obviously missing those areas, right? So I always say, and I always have a Typodont out. Get your Typodont. If you don't have one, order one. They're not that expensive. Look around the office. If there's one, collecting dust, just take it. Like, who cares? I always have a Typodont, and I always show them how to brush at a 45-degree angle. If you don't have a Typodont, and if you're like scrambling for time, use your hand, please, okay? Use your hand, make sure you have your PPE on, which you should, and just break down what you mean by brushing. This is the tooth, this is the gum line, these are the bristles, right? So I say typically when we're brushing, when we're growing up, they tell us to brush in circles. Reason being, because a lot of kids, and especially people with disabilities, have low hand dexterity, meaning they can't brush the normal way, but we want them to brush. So that's why they tell us to kind of brush in circles, right? But circles tends to avoid the gum line because we always want to focus on the teeth. The teeth gotta get white, the teeth gotta get clean. Of course we want them to get white, right? Of course we want them to get clean. And that's all perfectly fine and dandy. But what you're missing is the little poor gum line right here. They're not getting cleaned, okay? So what you need to do after you do all that cutesy stuff, you need to get down in there, right? And get down and brush towards the gum line. So you're going from a 90-degree angle, doing your little pretty circles, right? To getting down in there, 45-degree angle on the gums. You should feel the bristles going into the gum pocket. Remember when we probed you when you sat down? Those gum pockets, the space between your teeth and your gums, that's what we're brushing. And keep in mind, we have space, right? We have space. So that space can fill up with bacteria, food, and plaque. So in order to stay healthy, we have to empty those pockets out. Empty them out by brushing, by flossing, getting in there, getting on the tooth surface. That way we're not leaving all the plaque and crud behind. I had one patient was just amazed that I told them to brush in their gums, and they were like, for real? I said, well, this is why we are having our SRP today, because we're not brushing the appropriate areas. We have to brush on the gums. And so breaking that down, eventually they understood what I was getting at. And sometimes it takes multiple times for them to understand what you mean by that. I always like to say, and I love like a good analogy. I think I'm just the analogy queen. I think that's what it is. I love an analogy because I'm very visual. I'm a visual person. So if I don't have like an actual tree, like I always say, the tree is the tooth, the ground is the soil. If the soil is not good, if you're eroding the soil, the tree is going to get all wobbly. And then the tree is going to fall. Your tooth is going to fall out, right? So let's be gentle. Let's keep the soil on the tooth. Let's keep the gums and the bone on the tooth, right? So that way our tree can be stabilized. But let's also make sure the soil around it is getting good, right? So we're brushing, we're swapping the trash, we're cleaning out the yard, all the tree, the debris and nasty stuff that's, along the tree. We're getting rid of that, right? But we're also being gentle. That way we don't harm the roots, we don't harm the ground. So if the ground isn't good, the tree isn't going to be good. So always focus on the bottom, make sure we're stable, and then we can worry about everything else, right? Got it. So things like that, and of course not talking like the way I am, being very sarcastic if you couldn't tell, but just encouraging them and actually giving visuals and explaining in a simple manner as to why they need to do what they're doing and why they need to do it so they can stay healthy is a very good way to do it. So if you want to use that, let me know in the comments. If it works for you, it works for you. If not, figure out a way that works for you. Some things just fit your personality better. I feel like my visuals, my analogies fit my personality better because I'm kind of be goofy with my patients, because I feel like being goofy does allow the patients to be more forthcoming, more open, and less nervous. So if it works for you, it works for you. If not, that's completely fine. So I haven't had a lot of patients recently, as of recent, discuss oil pulling with me, but I will say there is not a lot of information on oil pulling. Still, it takes a while to actually do a research-based, type of clinical trial, and they're focusing on a lot of different things in the dental community. But I will say oil pulling with good health is beneficial. I have seen things where it talks about, obviously you're not going to just rinse off your body with water, no soap, no loofah, no washcloth, and hop out the shower. That's essentially what oil pulling is. Bam. I knew I would come up with something. That is essentially what oil pulling is for a lot of patients. And let me break it down a bit more. A lot of patients they know they have cavities. They know they have periodontal disease. They know some of their teeth are a little, like they about to sneeze and they're going to pop out, right? They understand that, and yet they oil pull. So try to, of course, the best way you know how, in the most respectful way, explain to them why that's crazy. It's crazy. Okay? Again, oil pulling with good health, with no bone loss, no infection, no bleeding, no pain, is beneficial. Of course, it's not an end-all be-all. And keep in mind, the biofilm doesn't go away with just swishing. Biofilm goes away with mechanical use. You have to physically touch the biofilm. You can eat, you can drink, you can be merry. Biofilm is still going to be on your teeth. That's why it's biofilm. You're eating and you're adding biofilm to the biofilm. You understand what I'm saying? So you have to physically clean your teeth before you do anything. Brush and floss, then use the oil pool. It's not going to do any justice. It's going to rinse right over the biofilm. Biofilm does not go away with rinsing. Okay, so that you have to understand and let them know they have to be in good health. It does not make cavities go away that are, I will say, they don't go away when they are super deep. If they're superficial, sometimes I've seen some articles say that you can arrest some cavities that are superficial, meaning they're still in the enamel. They have not broken down to the pulp. Some. Do not quote me. I don't even know where I found it at. It's been a while since I read those articles. Some, not all. So keep that in mind. But it does have some benefits to it. So yeah. And for the love of God, please brush your tongue. Y'all don't understand. There is bacteria everywhere in the mouth. Your tongue is not independent. Your tongue is part of your oral cavity. Brush that tongue. Your tongue should not be green. It should not be brown. It should not be white. It should not be yellow. If it's any of those things, please come see me and your dentist. Because what the heck? Brush your tongue. Your tongue holds so many microbes. It has pili. It's little things like this on your tongue. And it holds all of that bacteria. It holds all of that stank. Like, brush your tongue. I prefer a metal-based tongue scraper. If you want to use your toothbrush, by all means. For me, personally, my gag reflex, it kind of lights up when I use a toothbrush. So I just yank that thing. I just go, whoa, and pull it off. I do a couple of, moves here and there, and then I turn around and rinse, and I'm good to go. My breath is fabu. But brush your tongue, okay? Please. It stinks. It holds bacteria. It holds plaque. And if your pH balance is way whack, you can get candidiasis, aka a yeast infection on your tongue. Yes, you can. So please brush that in your mouth. Brush it, because it stinks. It should be pink, and that's it. Okay? And last but not least, because there's so many things I can say, I'll probably do a part 2 eventually. So I think I might just go ahead and tell this part 1, because my ADHD will forget. And I will leave y'all hanging. And I don't want to do that. I will say, I've seen about 5 patients this past week where they have had acid reflux. So of course you notice this through your EOIO exams, and you're paying attention to whatever they have going on. You notice the lingual side of their teeth, especially the maxillary teeth. The maxillary incisors catch the most heat, surprisingly, when it comes to GERD or acid reflux. When they have acid reflux, that is a great way to get a product in. Clinipro, MI-Pace, what have you. If you have products that you want to sell, even though you know they need it, this is a good segue into why they need this to help prevent cavities, to help prevent sensitivity, more breakdown of your enamel, what have you. That's a good way to promote that product. But obviously we're worried about their health. But I'm just letting you know, if you're trying to sell it, go ahead. But this is a good way to let them understand that this is a lot of patients don't know this. This is a good way for them to understand that this is very damaging to their enamel. And this will lead to a lot more breakdown and a lot more sensitivity and proneness to getting cavities. Because you're ripping away chemically your barrier. You're ripping away the bark off the tree. The tree has acid on it. It's melting away. It has nothing to protect it. So let them understand, if they're still having these, I like to call them episodes, if they're still having these episodes where they're spitting up, I like to break down nutrition, what they're doing after they eat, and also what they do after they have a breakdown. Nutrition wise, any type of red sauce, red meat, candy, obviously. And then also, once they're done eating, when the people lay down quickly and they don't give themselves their time to actually digest, when you lay down, your body kind of goes to sleep. So it kind of stops what it's doing and it rests, it relaxes, and you're not giving your stomach enough time to actually digest. So I suggest the patients right after you eat, give it at least an hour, 30 minutes before you immediately lay down. Well, for one, you should be brushing your teeth 30 minutes after. But two, you should definitely make sure you're not laying down, because you're not giving your stomach enough time to break down. And that's when a lot of people tend to have acid reflux, because they get up, the acid that's sitting on their stomach gets erupted, and then it comes up, and that's when they start to have that effect. So make sure they're taking time to digest before they lay down. If they know they're still doing the right thing, they're laying down 2-3 hours after they eat, suggest to them some type of some carbonate, that's gonna kind of like ease their stomach acid, so they're not having those issues. I also suggest high alkaline water. I don't have acid reflux. I used to, and I use this, and I have no issues. High alkaline water, anything that's like a 9.5, high is going to help ease the stomach acid. And of course, after they do have that episode, wait 30 minutes before you brush, but you can immediately drink some water, swish it out, don't swallow it, swish, spit, and then swish, and then swallow. That way the acid that is in your mouth isn't going straight back down your esophagus. You're swishing out the immediate acid that's on your teeth really well, spitting it out, swishing, and then drinking down, so that the water can neutralize the esophagus, so it's not creating any lesions or issues on the esophagus and the tissue. And then of course, after 30 minutes, I always recommend Sensodyne toothpaste, Clinipro, anything with a high fluoride toothpaste. And for those who don't like fluoride, hydroxyapatite. Hydroxyapatite is a part of the chain, the enamel matrix chain that does create your enamel. So for those who don't agree with fluoride, even though it's naturally occurring in most foods in a smaller dose, I would suggest using hydroxyapatite. David's on Amazon is amazing. I've seen great things. I've read reviews. I've even seen how it's like affecting the culture in Japan, which they are very prone to. They are very known for their good dental products. So if you have not checked out any Japanese products, do that. But that is the last thing I suggest. Just with the enamel, protecting the teeth, make sure that acid is not affecting the rest of the periodontium. And yeah, I don't know how many tips that was. Y'all count for me. I'm just kidding. Obviously, it's gonna be up before that. But that is something I suggest. I will say I definitely will do a part 2, because there's so many things that's popping in my head as I'm speaking that I need to say. So this is already at 30 something minutes. So let me pause. I will come back another day and discuss other products and other methods of being a hygienist. But also I've enjoyed, doing these videos. But guys, I need you to support me. I need you to like, comment, and subscribe. I am trying to be as consistent as I can. I am now taking my local anesthesia class, and it is taking a lot of time and a lot of reading. Actually, I got to get back on it right now. It's a lot of time that I have to put towards it, and it's a lot. So, but please like, comment, and subscribe, guys. I miss the feedback that I used to get. I would love to hear from you guys. I will try to do another giveaway as soon as I reach 2K subscribers. I will do another video, giveaway, hopefully multiple giveaways, especially for those who are new in hygiene. I would love to do that for you guys, but I need your support, please. So sorry. Need your support. Like, comment, subscribe for more videos. Well, I love you guys. I hope y'all enjoyed this video, because I did. If you have any questions, comments, or if you have any type of video suggestions, I will be more than happy to make those. Just let me know. Give me that feedback. Remind me, and I got you. Until next time, y'all are so sweet. Y'all gonna give me a cavity. I love you guys. See you guys soon.